It's something that happens to men. Once you turn 40, you start to lose 1 to 2% of your testosterone production per year. So by the time you're 50, you lost 20% of your testosterone. By the time you're 60,
from the heart of Long Island, New York, we are inside the GP studios where we wake up today, we go today. This is the Primal Mindset. We are empowering the midlife man, and we are powered by Go Primal Lifestyle. It is my lifestyle. It is my brand. Head to goprimalusa.com. Use code GPNation. Help support my mission of inspiring men every day. Wear the mindset to be the best for the ones that need you the most. I am your host, Chris Fontana. Alongside Jenna, we are on YouTube and Spotify. Please help support our mission. And unfortunately, we had to step away from NGBN. So me and Jenna stayed together. We are no longer associated with NGBN. The Primal Mindset is no longer associated with NGBN. And the company was going in a direction that we did not agree with. And me personally, as a man, my values, my morals, and my brand did not align with what they were doing. And we went our separate ways. So we are no longer associated with NGBN. But you can get us on YouTube and on Spotify. So please subscribe to us on YouTube. Hit that notification button. You can catch us every other Sunday, new episode dropping in the morning. Still part of Inspirational Sundays. So you can still catch us. We're still empowering the midlife man. We are just not going to be associated with NGBN anymore. So that is kind of the latest what's going on with us. And if you'd like to follow my mission of supporting midlife men, you can follow me on Instagram at Chris Fontana GP. I post everything I do pretty much on a daily basis. So if you have any questions, any comments, anything, please reach out to me. It's just it is my mission to inspire men to refuse to settle in life. So we got a great guest, a wellness doctor, really focuses on anti-aging, the latest programs or the latest medicines, however you want to put it. So I'm really excited to have him come on today. But before we get to him, this episode is brought to you by Momentous Supplements. I use these supplements. They're an affiliate. They're a friend of the show's. To be honest, I love the Fandos and the Tomcat Ali. They really boost some energy, the testosterone. You can feel a difference in the bedroom. They got a great sleep package that they sent me. Just really great products that I use personally. And as a midlife man, I need all the help I can get. So if you head to their website, livemomentous.com, use code GoPrimal15, and you will get a 15% discount on the whole website. All right, so we're going to take a quick break, and we will be back with the doctor.
Hi, Joel Maurer, founder of Dink Ninjas. Dink Ninjas was dreamed up and started right here in Austin, Texas, a dynamic pickleball community. We arm pickleballers with the paddles, apparel, and accessories to dink like a ninja. Dink Ninjas is dedicated to supporting mental health awareness and cancer research. Shop our full lineup at dinkninjas.com.
All right, back inside the GP studio on the Primal Mindset. We have our next guest is a doctor. He really is redefining wellness through cutting-edge anti-aging and regenerative medicine. It's Dr. Luis Fandos. Let's bring him on.
I love your the title of your show, Confidence is King. That's key for middle-aged men because we tend to lose that as we get older.
Absolutely, we lose it, and it's tough to get back, man. It is a mindset, but I think first and foremost, it comes back with not only getting better at something, getting stronger at something, and taking care of yourself and feeling healthy. And that's why I really wanted you to come on, because I think that you can really give some great information, some great So you have probably incredible knowledge on how the midlife man can really better themselves and gain that confidence back. So I appreciate you coming on.
Absolutely. So I think confidence is it's extremely important. When we're younger, when you're a teenager, you're learning, so your confidence is kind of low. So by the time you develop a great deal of confidence, you're in your 20s, mid 20s, and you get on with your career and things improve. But once you hit 40, things start to change. And the reason behind that is because we tend to lose testosterone. And there's something called andropause. We all know what menopause is, right?
Right.
But andropause is something that happens to men. Once you turn 40, you start to lose 1 to 2% of your testosterone production per year. So by the time you're 50, you lost 20% of your testosterone. By the time you're 60, you're 40% down compared to your levels at the age of 40. And that creates a lot of other issues. Not only confidence, but as you mentioned before, sex is extremely important. But also there are many other important things that testosterone does, which is protect us from cardiovascular disease, from cholesterol synthesization. It's associated with depression on older middle-aged men. When you have someone in their 50s that have developed some degree of depression and anxiety, and they don't really have a significant history prior to that, testosterone is important to be looked at, because that can be the reason why a middle-aged man is depressed.
Yeah, I mean, and how important it is also to maintaining muscle, building muscle. I mean, that's huge for men. I'm always constantly, I'm not really looking to put on huge mass. I'm not throwing around heavy weights, but just every day, at least doing some push-ups, doing something physical, lifting weights and like with the kettlebell. It's just, I never want to lose that strength, and obviously that first of all comes, with confidence. If you don't have strength, you're not gonna be confident. I got young kids, man. I gotta be able to, I just came home from work today, man. They want me to throw them up in the air and stuff like that. So to me, hey, it's a nice shoulder workout. I'm sitting there throwing them up. So yeah, I mean, I'm sure that plays a huge part in it as well with muscle.
Yeah, muscle workup, it's extremely important. In fact, 40% of our testosterone production is dependent on muscle activity, and not just any activity. Resistance training is where the money is. Many of us like to run, to do a long jog or run marathons and stuff like that. So aerobic exercise improves your cardiac and lung output, but it doesn't do much for testosterone. In fact, if you do too much,
it's the opposite, right?
That's the opposite, because it increases your cortisol. Cortisol is a stress hormone, and if you raise your cortisol levels, you're gonna reduce your testosterone production. So resistance exercise, you don't have to do 200 pounds. I usually work out every day with 20-pound dumbbells. I do it at home. 30, 40 minutes, that's it. You don't really have to go crazy, but you need to move. If you don't move those muscles, you have those factories, testosterone factories, sitting idle, not doing what they're supposed to.
Yeah, that was big for me as I got older, and like you mentioned before, I hit my 40s. Because I always had that mindset where you had to go, balls to the walls every day. You had to run the 5 miles. You had to do, to stay in shape and constantly work out. And obviously, as you get older and you have young kids, you don't have as much time. Lifting weights and resistance training, is probably the one thing that you can do less of and gain more results from. So that was huge for me when I ran the half marathon. I was around 42-ish. Ever since then, I haven't really run that much. I mean, I run really from my mental health. I like to run, but those long 5, 6, 7 mile runs those things are gone, man. I'll run a couple miles here and there, just because, like I said, for my mental health, I love it. But I noticed, just concentrating on resistance training. Like I said, man, it was like I did less of it and saw much bigger results, and obviously paired with nutrition, which we all know plays a huge role in it. The older you get, it's like that funny Adam Sandler line in Big Daddy. I have a milkshake, my ass jiggles for a week. So it's like, it's, you really got to watch what you're eating. So, and I know you guys do a lot of nutrition as well at your offices. Is it just strictly like what to eat, or you do that, the blood work where you really hone in on what this person needs?
Well, blood work is extremely important because that gives you a picture of where a person is at. We all tend to have lower testosterone. That's almost a given, but there are differences between each individual where one could benefit from a specific type of diet more than the other. So blood work does help quite a bit, but we use other diagnostic tools, including genetic testing. Genetic testing is something that unfortunately hasn't caught up into mainstream medicine yet. I guess that many doctors still need to catch up on that. But it is an amazing tool that give us a complete picture of how your genes are functioning, what parts of your cells are working well and which ones are not, and what you can do about it. And usually you can reactivate genes doing certain exercises and certain diets that are more specific for one person versus the other, depending on what the test results show.
And what does that consist of? The genetic testing, is that's like blood work as well? It's just different type of testing, or is it something else?
No, it's very easy and simple. All you have to do is swab the inside of your mouth for a couple of minutes. You have to do it early in the morning. And then you just put it in a little package and you mail it out to the lab. And then, you get results in about 2 weeks. So we test about 117 different genes, which are the most important that we need for the daily living. We don't go after the rare cancer genes to see if you have cancer or not, because if you have a pro-cancerous gene, in general, there's not much you can do to change that. But if you stay on track with your diet, your supplement, your exercise, you keep your inflammation down, you balance your hormones, you're going to stay as far as you can from that cancer. So that's why, there are a lot of genetic companies out there advertise about these different types of cancers. But the truth is that it's very hard to test every cancerous gene out there. So we focus on the ones that we know that are important for metabolic function, for cardiac health, for mental health, sexual function, and it's sort of, a bunch of other genes that are important for the daily activities and daily life.
So where do you go from, like, say, like, so say someone does the swab and it comes back, and like, so where do you go from there? Is it hormone replacement? Is it supplements? Is it, where do you go from there?
So it depends what it shows. So once you did the test, there's going to be a consultation with a genetic specialist. So we have each patient do a Zoom call with a genetic specialist where they spend 1 hour, and this person will, explain in detail in plain language what the test showed and what they can do about it on their own. And then we get those results and we incorporate that into a plan. So we come up with a plan that could be 6 months or 12 months. It depends on what your goals are. And by identifying what works and what doesn't work, we give you a complete plan of care with diet, exercise. We use peptides, we use exosomes, we do multiple things. It depends on what the test results show.
Yeah, the peptides thing, I was reading about that. It was interesting because what caught my eye was the arthritis, which I feel like actually I have a few questions. What are some early signs of arthritis? I know, like, my hands, I cramp a lot, and I worked manual labor for a long time, so I feel like every time I'm trying to give my wife a massage. My hands are cramping up, very quickly. So what, is that an early sign of arthritis?
Well, I mean, arthritis can manifest in many different areas. It depends, what have you used the most during your working life? I mean, obviously, if you work with your hands, you may develop some arthritis in your thumbs, usually because the thumb does a lot more force and work than the rest of the hand. But also it attacks larger joints like hips and knees because they support the entire body weight during the time that you're up and moving and running and going up or down stairs. So yeah, pain usually in the morning, getting out of bed, and then it gets a little better as the day goes by, and then gets worse again at night. Those are early signs. And listen, once you turn 50, I don't think there's any person out there that doesn't have any pain whatsoever.
I mean, you get up in the morning, you're struggling.
Yeah, you do.
I'm 44, so you get up and you're like, oh my God. But once you get moving, you get moving. I mean, fortunately for me, I don't really have any pain in my body other than my hands. So it's mostly like when I'm starting to use them for a while, I feel like they just get very tired very quickly, and I have to kind of go like that, and I crack them, which I heard is not good to do, but it's a kind of a habit.
I don't think that makes a difference one way or the other.
Okay, good. I want you to say that again, so when my wife hears it, I'll be like, well, the doctor said I can keep cracking them, so
I'm sure she gets annoyed by it, but but it doesn't change the course of the disease. So arthritis basically it's a net loss of intra-articular cartilage, right? And the reason why that happens, I used to tell all my patients that it's a wear and tear disease, which it makes sense when you say that, but recent studies have shown that arthritis is due to an activation of your immune system. So we have certain enzymes. Do you know what an enzyme is?
I know the name. Yeah, I know the word. I don't know.
So it's like a little Pac-Man, right? That will eat away. So the purpose of the enzymes inside the joints are to eat away the broken down cartilage. So when you start moving around, it creates microfractures inside the cartilage. And so those turn into crystals, right? So the enzymes go in and digest those crystals just to keep the joint clean. However, when these enzymes are hyperactivated, they not only go after the crystals, but they go after the normal cartilage, and they start eating away your own cartilage, the good cartilage that is covering the surface of the joint. That's one problem. The other problem, by not being hormonally balanced, which is not abnormal to see at the age of 50, meaning you don't have your testosterone levels where they need to be, your stem cells that's supposed to repair that joint are not working up to par. So you have enzymes that are degrading joints, and then you have your stem cells that are kind of falling behind. So at the end of the day, you are left with a net loss of the cartilage, which is the silk surface that covers the joint. And by losing that cartilage, then you have the rough surface of the bone that starts to show through the cartilage. And now you have like two rough surfaces rubbing against each other. It's like, instead of silk, you have sandpaper that creates friction. The friction creates inflammation and pain. And that's how the process, continues.
Okay. And you said something interesting, stem cells, which I definitely want to get back to. But so as far as the arthritis goes, is there really no cure for it, or is it the peptides is the cure for it?
I think I wouldn't call it cure, because there's no, the peptides are being used off-label, meaning that they've been studied quite a bit, but there are no formal studies that show that can cure arthritis. Not yet, at least. I know there are many, many studies that are ongoing right now. And I would say in another 3 to 5 years, they're going to come out and they're going to show that it is a modifying, disease-modifying drug, or peptide is a chain of amino acids. Actually, I wouldn't call it a drug because our body makes peptides. But once they come out, then we're going to be able to say, yes, this is cured. But right now I cannot say that because it's, it's off-label.
But it helps it. It helps
But
it a lot.
in my personal experience, it makes a huge difference. I have, I have many patients. I have family members. My mother, she had bone-on-bone arthritis of both her knees. She was scheduled for total knee replacement, and she was deadly afraid. So she calls me 2 weeks before surgery. She goes, I don't think I can go through this. I'm because she's seen other friends that have gone through total joint replacement, and they have not done well. Not to mention the fact that total joint replacement is a palliative surgery because you're fixing that joint, but the systemic process still goes on and attacks other joints. So it's not like you're solving a problem; you're solving that problem for that particular joint. Right. But then I think so. We put her on peptides, and this is like 4 years ago. It's funny because when she spoke to her orthopedic surgeon, he was pretty upset, and he told her that it was just a matter of time before she would come back crawling, asking for the surgery. Yeah. And it's the other day I was with her. We were having some dinner together, and we were remembering that. And it's been like almost 4 years since we started the treatment, and she's doing great. She's doing amazing.
Wow. So what are you? I mean, you obviously. I don't know how it really works, but I know when you first started becoming a doctor, I believe in '97, you got your doctorate. Was it strictly always like this, like pain pain management, but using like more holistic?
No, this is more recent. So I've been in pain management for 25 years. And up until 5 years ago, I was not really into what I'm doing right now. And the reason why I got into this was for personal issues. So I turned 50. I'm 57 now. So I turned 50.
Yeah, you're younger than me. I got to get some of those peptides.
So I turned 50, and all of a sudden my blood pressure starts to go up, right?
Yeah.
And I have always exercised, and I have always kept a great diet. I stay away from sugar, stay away from desserts. I always had some wine here and there, but never abused alcohol. So I was doing everything right. My blood pressure starts to go up. Okay, well, maybe stress, work, whatever. So I go to my primary care. He gives me a blood pressure pill. 3 months later, I go for a checkup, and now my cholesterol is up. Okay, here's a pill for cholesterol, right?
Yeah.
Crestor. 3 months after that, I go for another checkup to get the cholesterol checked, and now my blood sugar is up. My A1C is in the pre-diabetic range.
Wow.
So all of a sudden, in a matter of 6-9 months, from being completely healthy, turned 50, and I developed high blood pressure, pre-diabetes, high cholesterol. All right, so they put me on metformin to lower the glucose, which it never worked really. But what put me over the edge is that I have several cardiologists that are really good friends of mine. We'll go out all the time. And 6-7 years ago, a new like state-of-the-art test for the heart came out. So my friends were, all talking about it, and they go, "You have to go and get this test done. We're all gonna go." It's basically a coronary CAT scan where they look at your coronary tree in your heart, and they also look at the calcium score. The calcium score is basically a predictor of how much calcification you have in your coronaries, and what are the chances that you're going to get a heart attack in 10 years. So the calcium score goes from 0 to 500. Mine was like almost 400.
Wow.
So I was like, all of a sudden my world was crumbling because I was having high blood pressure, pre-diabetes, high cholesterol, and now the chances of having a heart attack were pretty high. So I go to my cardiologist, and I said, "What do I do?" And he goes, "Well, you have to, get your diet in line." I'm like, I'm eating perfect. I'm eating all the green vegetables, staying away from, fatty foods and all of that. And he goes, "Okay, then you have to exercise." Man, I'm already exercise every day. And the final answer goes, well, I guess that we'll wait until you have an issue and then we'll put a stent.
So you got to wait till you have a heart attack for them to help you?
Basically, that's what I said.
That makes sense.
That's traditional medicine. And that's when I said, that's when I said, you know what, this can't be it. Because if in someone in my position that have access to all the tests and all the doctors, I have their cell phones and I can communicate with them, and they're my friends, they're telling me that there's nothing they can do for me, and I have to wait until something happens.
Wow.
When it has you score that high, it was just a matter of time before I wind up having a heart attack. Right now, my coronary tree was, at that point, was open and clean, but it was like, just like a little bit of a time bomb. So, and that's when I started getting into the functional medicine world. The difference between traditional medicine and functional medicine is that the science is the same. The tests that we do are pretty much the same. The difference is with traditional medicine, we treat symptoms. So I developed high blood pressure, they gave me a pill for it. I developed high cholesterol, they gave me a pill for it. I developed high blood sugar, they gave me a pill for it. But nobody asked why I was having those issues. They just saw the symptoms, here it goes, here's a pill. Functional medicine, which is what I'm doing right now, and that's why I'm so passionate, is we try to understand why. Why are you having high blood pressure? Why are you having high cholesterol? Why are you having high blood sugar? And by understanding the root cause of the problem, then you can address that and treat it that way, as opposed to getting pills for the symptoms. And for me, it was basically low testosterone, and I had some hormonal imbalances that I corrected. Use of peptides, because peptides are a chain of amino acids, right? That's what a peptide is. When you have, an amino acid is the smallest unit of a protein. When you put up to 50 amino acids together, we call them peptides. When there's 50 to 100, it's a polypeptide, and more than 100 amino acids together is a protein. So our body makes a lot of those, and those are tiny, tiny intracellular messengers. So as we get older, we lose those messengers, and our cells, they kind of get lost. And they do the best they can, but they don't perform as well as when they have the communications. Just think about it, an army trying to defend against an attack with zero communications or with little communications. Each soldier or division is going to be doing whatever they think is best, but it's not, as a whole, doesn't work as well. So basically, the aging process is a loss of intracellular communication due to the hormonal imbalances and peptides. So by restoring hormones, by restoring peptides, you're giving back that cellular communication. Now your cells in different parts of your body can communicate more efficiently with each other and do what they are supposed to, and do it at their best.
What do you think that was? That just really declined. I mean, obviously, you say you turned 50, but is that all it was? It's just like miscommunications inside the body for it to like drastically, go down. And which I did have another question, because everyone says cholesterol, watch what you eat. Does that really have anything to do with what you eat, or is that more like genetics, or kind of like maybe prone to have high cholesterol? Because they say eggs bad? I mean, I eat at least 4 eggs every day, so and I never had any issues with cholesterol.
So, for example, I know I have a few patients that are vegetarians and some vegans that have cholesterol through the roof.
Yeah. Okay.
How do you explain that? Right.
Yeah.
Cholesterol is animal fat.
Right.
That's what it is. Not a plant-based fat.
Okay.
So yes, there are genetic factors. Okay, those are important, and that's when you identify that on genetic testing. But there are also loss of efficiency in your body. Your cells lose that intracellular communication, and they don't metabolize the cholesterol the way they're supposed to. Remember, we need cholesterol. We cannot live without it.
Right.
All the hormones that we have are made out of cholesterol. If your cholesterol is below 140, then you're not making the hormones the way you're supposed to. But if it's 250, that's too much. Everything in our body has to be a balance. You cannot have too much. You cannot have too little. It has to be in a balance. And then answering your other question, why that happens is it's simple. We are mammals. We are in nature as like any other animal out there where we grow, we reproduce, and then we're supposed to go. 1,500 years ago, men couldn't live more than 38, 39 years.
Yeah.
We are genetically coded to live 39, 40 years. We live twice as much because of modern medicine. So we live twice as longer, but that doesn't mean that we live better. So many of the bodily functions that we have when we're 30, you're not going to have them when you're 50 because you're not supposed to be on Earth anymore from a genetic standpoint. We're still on Earth because the modern medicine saved us. We have penicillin, we have antibiotics, we have a lot of drugs that were discovered that prolonged our lives. But genetically, we're not performing at the same level because we're not supposed to be here. Once you turn 50, you're not supposed to be here. So that's why your body's not functioning at that level. So by using anti-aging medicine, many people think anti-aging is about aesthetics. And yes, aesthetics is a portion of it. We're like to look good, but it's aging is a disease. Our bodies doesn't function the way it's supposed to because we don't have the elements to maintain that intracellular communication. And those elements are summarized between hormones, peptides, and a bunch of nutrient supplements that if you are not getting them through your diet, then your body won't function properly.
Yeah. So how do you actually get the peptides? How does that work? What is it? A supplement? Is it IV? Is it pills? What is?
It depends. There are peptides for almost everything that you can imagine. Our bodies make 7,000 different types of peptides. We have been able to chemically reproduce in a lab about 40 of those. And you have different peptides for different issues. You have peptides for gut issues. You have peptides for autoimmune disorders. You have peptide for arthritis. You have peptide for muscle building. So some of them can be done orally. Some others have to be injected because they are. Some of them are very light, very small, and when they go through the gastric juices, they get destroyed. So then, by taking them by mouth, then you won't get the effect. So it has to be injected. So usually it's a subcutaneous injection underneath your skin in your belly. But those are some. For example, Ozempic and Mounjaro are peptides.
Okay.
These peptides have been around for 40, 50 years. But, some of these pharmaceutical companies picked them up. They did large clinical trials. They showed the efficacy. They get the approval of the FDA, and now they're selling, $40, $50 billion a year on those. But they are peptides. So Mounjaro, which is terzepatide, and Ozempic, which is semaglutide, are usually made in your body. But as you get older, you just don't make as much. And some people, because of genetic predisposition, they don't make it even when they are younger. That's why they tend to gain weight and develop, early onset diabetes and stuff like that.
So is it like, is it a vitamin? Is it something you would have to do daily? Or is it kind of depends on the person and the situation?
It depends on the person and the situation. If you have, let's say you have diabetes and weight gain, you're probably going to need that for the rest of your life. Right. You don't have to use it all the time. Once you're stable, you may go off of it 1 month, and the next month you go back on it, and then off and on. And then if you're using it for growth hormone, muscle building, usually I like to cycle them. I don't want anybody to be on them constantly because I don't want the body to get used to it, right? And then not having the same response. So we cycle them. The ones for gut, same thing. You use it for a couple of months, then you stop, then you go back on it. And obviously, if you are feeling good, then you can take a break from those, and then you go back on it sometime later.
Yeah. Okay. Yeah, we're just gonna take a quick break, because then when we come back, there's some more services that you do that I definitely want to get into. So we'll be right back.
In a world where settling is not an option, where confidence reigns supreme, there's a brand that embodies the spirit of empowerment and refusal to compromise. Introducing Go Primal, where every thread exudes strength and determination. Elevate your experience. Shop now and unleash your inner champion. Because when you wear GP, you're not just dressing for success, you're embodying it. Go Primal, where confidence meets courage. Refuse to settle. Shop now and conquer your world.
Focus up. Hey man, zoom in. Welcome. My name is Chris Rubio of the Rubio Method. Soak it in. Wear it as a nice sweatshirt, a nice yellow sweatshirt. See if it fits. And it may be something you say, okay, I'm listening to, but I don't really like it. Not for me. What the hell are you thinking? You have no idea what you're talking about. You have issues because of your bad taste.
We are back in the GP studio on the Primal Mindset, talking to Dr. Luis Fandos. There's one thing I saw, I believe it was on your Instagram page, was the thing that the mask that you put on, you having the people on the bike pedaling, I guess, on the stationary bike. That looked pretty interesting. What was that?
Oh, that's a great tool. And I see that you had a commercial for athletes. That's a metabolic testing equipment, and it's a super high-end piece of equipment that high-end athletes have access to. So what it does, it reads your VO2 max and the way you burn calories and how efficient you burn calories based on your heart rate and the energy output. So we sit you we sit you on a bicycle that is connected to a computer, so it reads how much output you're doing energy wise. Then we put a cardiac monitor, so we read your heart rate, and then the mask that it analyzes your exhaled gases. So basically based on how you burn calories, you're going to release different gases. And all of that gets uploaded into a cloud, and a bunch of PhDs will analyze that data and will give you a whole picture of where you at metabolically and where you need to be compared to subjects that are doing optimal in their careers, if they are, for example, athletes. And not only that, but you get your own app. And it downloads all that information, and it gives you tips on how to work out, what type of workout, how to eat, when to eat, a whole thing. And it's in your phone. And then 3 months later, you come back for a retest and you compare to the first one and you see if there's improvement. If you're going the right direction, you just stay with that plan. If things are not improving the way you want to, then things are adjusted. But athletes, always are looking for the best way to improve their performance, because that 1, 2, 3% extra can make a difference,
right?
When they're competing.
You said athletes. Is there kind of like guys like, say, like me, just man, I want to stay in shape, and longevity is the name of the game for me. Like I said, with the young kids. So you have clients like that are doing that? Because that sounds an incredible amount of information and useful information. That's
super useful. In fact, the vast majority of people that do that are regular middle-aged men.
Okay.
So we have an athlete population, MMA fighters. So we're connected with Flex Fight, and so we have a number of athletes coming through. But yeah, the vast majority of people that are using that equipment are men or women that want to improve their metabolic performance. They want to see, everything on numbers, And this is real scientific data that they can follow, and it's stored in their phones. So then they get the tips of what to eat, how to exercise, and then they can try again a couple months later and see what degree of improvement they have.
Wow. So when you say like how to work out, does it give you like what type of workouts, like how many days a week you should be working out, mixing in cardio or not? Does it actually give you like a workout program?
Yes, it does. It tells you
wow.
how many, the length of time, what's the best time of the day. That's key. Because sometimes it's better, for some people it's better in the morning.
Right.
For some others it's better in the afternoon. It gives you how much of aerobic versus cardio versus HIIT, high intensity interval training, versus resistance training. And it gives you the percentages that are best for you based on your metabolic output.
Wow.
That along with the diet is key too.
Right. I'm sorry, I didn't know if you said, is nutrition mixed in with it as well? Is it? It
is.
Oh, yes. Wow. It tells you what types of foods to eat, and when you said when to eat, I mean, I think that I always go back and forth, like time of the day. If it eats, like they always say, don't eat late at night, but I always said, like, if you're hitting your calories, and it doesn't really matter. But I mean, I don't know. As I get older, I kind of I get a little bit affected if I do eat late at night. Not only I guess gaining weight, but really more like sleep is what gets affected if I eat too late at night.
Yeah, so a lot of us, we do things that we think are better for us. Mm. We try because we read and we look at things, but we don't really see. We don't know for sure if what we're doing is the right thing for us or not, right? So some people will benefit from intermittent fasting, some other people wouldn't.
Right.
Some people will benefit from 4 meals a day. Some others will be better off with 2 meals a day.
Right.
And what type of meals? And you can see this in actual numbers with scientific data, not just your subjective feeling of what you think it was working better for you or not. Now you have numbers that are stored in your phone, and you can follow that throughout the course of the year. Usually we tell the patients we'll take 12 months. We do a 12-month membership, and every 3 months they come in and they do the test, and they see the improvement based on each test.
So how does it into the app daily? Are you putting in information like certain workouts you do, or is it how does that work?
Well, what it does is once you did the testing, everything gets downloaded in your phone, and then it gives you the entire for weeks, 3-4 weeks. And then if you're feeling a lot better, you can wait until, you're up for the 3 months. If you want to get tested before, you can. Let's say if you're really anxious, then 6 weeks later, you can do it. But usually, because the changes are slow. And sometimes if you do the test only 6 weeks after the first one, you may not see much difference. But 3 months later, you definitely will, if you're following the directions. But yeah, the app gives you, for day of the week, what you need to do. It takes you by the hand. I mean, it's simple and easy. And again, with real numbers for you, just for you, based on your data.
What is your take on intermittent fasting?
Well, I think it's, there's something called autophagy. I don't know if you heard that term before.
Yeah.
So autophagy is the cellular cleanup, right? So when a cell makes energy, it creates a lot of waste at the same time. Just think of, if you're working in your kitchen, you're making a meal, at the same time you're making the meal, you're also creating waste, right? But at the end of that day, you're going to take the garbage out of the kitchen. So that will be the autophagy process. Now, the issue with our cells is that taking the garbage out, it's a very lengthy and complex process that takes time. Some people can take the garbage right after, and some others, like in my case, it's very slow.
Right.
So if you're not taking the garbage out in time and the next meal comes in, now you have garbage from before, you're accumulating more. And the same thing after the next meal and same thing. So eventually you're going to have so much garbage in the kitchen that you won't be able to cook, right? So the cell gets intoxicated by all this waste by not giving time to clean out. So by doing intermittent fasting, you're giving your cells a break. allow them to clean up before the next meal comes in and they have to process it.
Right.
But some people process that very quickly. They don't need to do intermittent fasting. Some others will need it.
Yeah, I messed around with every, eating window. I did, the 16/8, the 24. I did one meal a day. I've done like doing long fast, like one long fast a week. I've been up to like maybe like a 36-hour to 40-hour fast before.
Ooh, wow.
I tell you, the one thing I do notice, believe it or not, is how much energy I have. Because
well, yes, when you fast, you are doing several things. Number one, you're increasing your growth hormone release.
Yeah.
So that affects everything, right? Number two, you're activating something called AMPK. I don't know if you heard that term before.
No.
The AMPK is the master regulator of energy in our body. So our body thinks that you're in an emergency situation and it needs to gather energy because you're not eating, right? So it activates all the energy productions on your cells. And since there is no need to allocate energy to digest food because your stomach is empty, all that energy goes into your brain and your muscles. And that's why you feel that you're ready to go. You feel stronger.
Right.
Because when you eat, right after you can't, if you eat a large meal, you can't do anything because a lot of that energy goes there. But with the AMPK activated, now you have extra energy that it can be allocated to brain and heart and muscles.
Yeah. I usually leave it on like a Saturday when I'm home and I got, doing stuff around the house, watching the boys, and then I go to work at night and I won't eat again until, Sunday morning. But like I said, throughout the day, man, I feel good, and it's usually when I'm doing a lot of things, because then mentally you're staying busy, so you're not really thinking about.
Oh yeah, you're fully focused. Now that doesn't work for everybody. Some other people,
right.
That don't function that well, they do that and they can't do anything.
Yeah.
But that varies from person to person. This is where the metabolic testing comes in, along with the genetic testing and all the other things that we do. Because
yeah, I was gonna say, because it's you watch all these videos and they say new studies say the 16/8 is the best, and new studies say if you do one meal a day, then new studies say one long fast a month. So it really depends on the person.
Exactly, and it's all over the place. It is all over the place. So there was a study that came out in the New England Journal of Medicine that I think it was poorly made. That showed intermittent fasting can cause cardiovascular disease.
Yeah, I saw something.
You saw that?
Yeah.
But and they didn't do any genetic testing. They didn't do any metabolic testing. They just did a blanket statement, and you can't do a blanket statement on something like that because you're scaring off a lot of people, and maybe a lot of people are benefiting from intermittent fasting. I know those people, they're not going to do that anymore because they are scared. They heard that you can actually hurt yourself. But the truth is, every person is different. If you do the testing, you follow the data, then you know what you're doing.
Right. And I always do what I feel is best for me because I hear things and I'm like, let me try it and see. And then I see what works best for me, what I feel the best with. Because to be honest, I don't think I even trust a lot of the studies that are out there because some of them are not even done on humans. They're done on mice. Then some of them are done on humans, but it's a very short span, so you don't know. I even heard that the reason 16/8 came about was because they weren't able to physically sit there and watch humans for more than 16 hours to see what the benefits were. So they just said, all right, 16 hours is the cutoff. So it was just man, you know what? I'm gonna just do what makes me feel good and
that's what happens. At the end of the day, everybody winds up doing whatever they think is best because scientific data, it can be very problematic if it's not properly done. It just can cause a lot of problems, and there are many studies out there that change the way we practice medicine to find out years later that we're wrong and that we're flawed. And now we change back. So the pendulum goes back and forth. So, in medicine, we're used to always use scientific evidence. And the problem is we all, many of the doctors read that and they just buy it. They don't, digest the data and look at how the study's been made and how important is this. There are so many factors that are that can take part on the result of the test, and you have to understand what those factors are to make changes in your practice. But there's scientific tests, studies that are very well done, and some others that are very poor. This one about the intermittent fasting that increases cardiovascular disease, I think it was poorly designed.
Yeah. It's so hard to trust anything. So I think you're just better off going with your gut, or if you're able to, go get the testing. That you provide.
Obviously, the testing gives you the real data. It takes the guesswork out of it. Because right now it's all guesswork. You think this is doing that. You try different things to see what works, what doesn't work, but you're not 100% sure unless you see the actual numbers from your own for your own self.
Right. Yeah. And I know we're kind of short on time. I mean, I can probably talk to you for hours about all this stuff, but the other thing I noticed you had, which is I was always interested in, was the IV drip with like the vitamins. And I listen to Joe Rogan a lot, and he's always talking about, oh yeah, you feel bad, go get a vitamin drip. It's probably a lot easier for him to do it, but is that also something that like you would have to do daily, or again, depends on the person?
No. The issue with vitamins is that it depends what your gut health is, right? Because vitamins have to get absorbed through the gut. And if you're taking omeprazole, or if you have, if your microbiome is not the adequate one, then your vitamins may not get absorbed. You're taking them, you're thinking that you're doing the right thing, but I cannot even tell you how many patients I get in the office where we measure the vitamin levels and they are in the gutter. And they bring the vitamins, they're taking all their vitamins or supplements and they're not getting absorbed. So those patients definitely benefit from IV because you are bypassing the gut and it gets directly into your system. So patients like that we identify that they have low vitamin levels despite the supplementation, is definitely IV vitamins are indicated. Another scenario is patients that are going, running a marathon or just got hungover and they get dehydrated. And there are multiple scenarios, but the most common one is that your vitamins might not get absorbed the way you think they are, and then you're not getting the benefit. And by measuring that, and we see that on paper, then we recommend IV vitamins to those.
Right. So really, what would you recommend? Like, say someone, they listen to the show, and what would you say the first thing you would recommend for them to come in and do?
I think that to get tested. Testing is key.
Blood
because
work or genetic?
It depends. Obviously, genetic is a little bit more expensive. Blood work is usually covered by insurance. Genetic test, yes. Genetic testing is not. So it depends on the person. We try to work with whatever we have. Obviously, the more data we have, the better it is. But if someone says, listen, I cannot afford genetic testing, we'll work with the blood work and we can measure vitamins. And they say, you're taking vitamin B and you don't have any on your blood work, or D. Vitamin D is, everybody's deficient of vitamin D in the Northeast because 90% because if 90% of your vitamin D is made out of your sun exposure. We don't get sun exposure. And also, if you get too exposed to the sun, that's not good either. So it's
right.
It's
always
always
that fine line with everything, man. It's like,
so, but at the end of the day,
a little bit and you're screwed. So you're
screwed, exactly. So the best way is just to get tested. Like I said, so blood work is covered by insurance. Genetic testing and metabolic testing is not. So it depends on how much you can do. But listen, there's always something we can do, even if it's just blood work.
Right. Is there anything else that's covered with insurance, or is it just strictly the blood work?
There are some supplements, some hormonal replacement that we do that might be covered by insurance. We see a lot of perimenopausal women Some of the patches that they use or oral progesterone is covered. Not on everybody. Unfortunately for men, it's an issue because the insurance companies have a cutoff for 300 micrograms as your testosterone level. So if you're at 300 or below, or if you're 299, then you're low in testosterone. They will pay for your testosterone.
Right.
But if you're 301, they wouldn't. So,
which is still very low. You're still screwed on that one.
Yeah, you're screwed. So the data shows that any man at any age needs to be above 600 to protect yourself from cardiovascular disease, lipid dysfunction, weight gain, depression, osteoporosis, Alzheimer's. It protects you from so many conditions, but you need to be up there. You need to be at 600 or more. So
is that your cutoff?
Yes.
If you're at 600, you're good. Anything below 600, you consider that low?
Correct. Yeah.
Okay.
And also it depends on the person. If you're at 500, but you are 30 years old, because there are a lot of younger men that are low in testosterone, but they want to conceive, they want to have children. You don't want to put them on testosterone because testosterone it's one of the most effective birth control mechanisms out there.
Okay.
And unfortunately, not if you stop testosterone replacement, not every man comes back from that. So I always have a serious conversation. I ask them if they are young, I tend to use other things that would increase testosterone levels without having to supplement them. If they're at 500, you gotta get to 657. So sometimes with some supplements you might be able to get there, but if you're 400 to get to 800, it's very difficult.
Yeah, I heard it's replacement is the only way to go if you're that far off. So where can people? I know you're in West Islip, which is my old hometown, by the way. That's where I grew up. Give people all your info, because this was a lot of useful knowledge especially for midlife men. So people in the area, hit them up and just let people know where you're at.
Website is alleviating.com. It's 631-909-6036.
Nice. All right, there you go. So people, I think, should definitely hit you up. And I didn't realize the blood work was covered by insurance. So I think I'm going to come in and do that, because I definitely want to see where I'm at.
That's a starting point, because you start with the blood work, and then if we see issues, then we can recommend other things. But we can do quite a bit of work just with the blood work. Yeah,
nice. Yeah, I'm definitely, I think, going to come in. But thank you very much for coming on, man. I really appreciate it. And anytime, please come on. I'd love to. Like I said, I can sit down and talk to you all day about this stuff. So anytime you want to come back on, you're more than welcome.
Thank you so much. Appreciate it.
All right, man. Talk to you soon.
Take care. Bye-bye.
All right, that was Dr. Luis Fandos. That was some really great information. I definitely want to have him come back on, but we're going to take another quick break and be back with Long Island Matters.
Hey, this is Chris Rubio, host of The Rubio Method and Decades. I just finished a workout. I'm all hot and sweaty, and it reminded me, let me tell them about Chris Fontana's gear, Go Primal USA. It's a mindset, it's apparel, it's everything. You need to check it out if you have the Go Primal mindset. GoPrimalUSA.com and use the code Rubio10, that's Rubio10, for a discount on all gear.
Drinks are fun, but alcohol isn't. Meet ProofNoMore.com, the #1 marketplace for the best non-alcoholic craft beverages. We offer the largest selection of non-alcoholic beers, NA wines, zero-proof spirits, and mocktails. So if you're in the mood for a rewarding brew or a cocktail without the booze, give Proof No More a try. Live more, proof less, at ProofNoMore.com.
Everybody going through it. Everybody going through it. Everybody. But we still gotta pursue it. Gotta do it. Cause we all going through it. Everybody going through it. Everybody going through it. Everybody going through it.
All right. We are back on the Primal Mindset inside the GP studio. It is the Long Island Matters segment brought to you by Go Primal Lifestyle. Head to goprimalusa.com. Use code GPNation. Help support my mission of inspiring men. We have the mindset to be the best for the ones that need you the most. All right, here we go. As you saw the commercial, Proof No More. Sponsors of the show, non-alcoholic beverages, wines, spirits. I was actually sipping on this new one, Momentum Brewery they have here in Bayshore. This one is the cold style, very good. And man, if I want a nice cold beer, it's nice to know that I can have it. If you head to proofnomore.com, use code GoPrimal, you get discount on the whole site. So, check them out, help support those, support this show. We also have at Sweet House Ideas, these chocolate covered desserts, these silk flower arrangements. They never die. They're beautiful. I actually just had some nice chocolate covered strawberries from Mother's Day that I got for my wife. And they were delicious. I love the mini donuts that she has. At Sweet House Ideas on Instagram. Please hit up Angie and order today and help support those that support this show. Also, Long Island Prep, a great organization. My friend Paul Vecchione is the founder. He's been on the show a few times talking about Long Island Prep. They really focus on the pillars. They really have this program set up for schools to tackle mental health issues, addiction issues. They help teachers, they help parents, they help students. It is here local on Long Island, but he does help schools across the country, has great programs, online resources. So if you're a teacher, if you're a parent, if you're a student and that needs more help with mental health, addiction, please hit up Paul Vecchione at longislandprep.org is another supporter of the show. So please go support him. And also we have a new business is our power washing business here on Long Island. He does really great work. Power wash company. His name's Chase Ward. I believe he's out of Farmingdale. And me, I love power washing, but I do not want to do the whole house like that. So I think I'm going to hit him up and see how he can help me out. But yeah, he's local here on Long Island. Does great work. So if you're looking for any power washing for your house, for your patio, for any of your power washing needs, hit up Chase Ward. So that was the show, man. I want to thank Dr. Luis Fandos for coming on. Like I said, really knowledgeable guy, and that was great information. Thank you to the sponsors. Without you, I would not have a show. Thank you, Jenna, for making this show great. So as always, confidence is king.